has a low network connection. Hello everyone, Dr. Rose here coming to you guys live. I'm still away, still on vacation, but heard the unfortunate news yesterday about Fox 2 News' meteorologist Jessica Starr taking her life, and all the sharing and just outpour of condolences that were online yesterday. And I had a few people to inbox me just questioning how could this happen? Oftentimes when something like this happens and we're not able to make sense of it, we want to reduce it down to something that's understandable to us. I know this from personal experience with just 2 months ago with my niece, my sister's oldest daughter, taking her own life, and how devastating that continues to be for my entire family, and how we continue to try to make sense of this. I saw a lot of statuses indicating, with the caption, depression is real, depression is real. And we know depression is real, and we know depression is definitely a contributor to suicide. One thing I want you guys to understand too, because there's so much conversation and so much education and awareness needed on this topic, it's not just always depression. When I saw the headlines yesterday regarding Jessica's suicide, for some reason, the first thing I questioned was there any medical conditions that she was experiencing that could have contributed to this? What we fail to realize is that oftentimes suicide is not just due to depression. Suicide is not sometimes due to mental illness issues. There are numerous physical issues. There are numerous physical, or medications, I should say, for physical reasons that could also be a contributor to suicide. I want to share a story with you guys. Several years ago, I had a patient to come in, and I've been seeing this patient for some time. And depression was not even one of her issues. She had been coming in for other adjustment issues, workplace issues. And I remember her coming in one session, and she visibly just looked different. She visibly did not look like herself. And there was an element of just sadness and depression there that I had not seen before. And she verbalized to me that she had recently, surprisingly to her, been having some suicidal thoughts. And this individual had never had suicidal thoughts before. She, again, was coming to me for totally different reasons. And one of the things I asked her was if she had recently started any new medications. And I'm not talking about psychiatric or psychotropic medications, although we know there's a correlation to that as well. But I was talking about just any medications in general. And she shared with me that she had recently started a new birth control method. And the reason I knew myself to ask her these questions is because of an experience that I had 10 years prior, when my OBGYN actually prescribed me NuvaRing, which is a popular birth control method. And anyone who knows me knows that I'm probably one of the most happiest-go-luckiest persons around. My mood stays pretty consistent and stable. But shortly after being prescribed that medication from my doctor, like I said, over a decade ago, I started experiencing a great deal of just depression, to some extent not being able to get out of the bed in the morning, and it scared me terribly. Even thoughts of, is it even worth being here? And I knew that wasn't me, and I knew something had to explain that. So I actually went on and started researching that particular medication, and found out that was one of the side effects of NuvaRing, one of the side effects for the medication for this birth control method. And I immediately had it removed, and within 3 days my mood was back where it was supposed to be. So today we're seeing, or late yesterday I saw with even Jessica Starr's story, that she was having complications from her LASIK surgery, and that's so far removed, if you think about it, from what people would think would even contribute to any type of suicidal ideation. But they're starting to wonder or look, and I saw articles today saying how there are other cases of individuals who underwent that procedure. Now, I'm not trying to scare any of you guys off from, any type of particular medication, but what you have to understand is that we all are different, and our bodies respond to different medications differently as well. And we have to be an advocate for ourselves, and we have to educate ourselves. It's very understandable why we would want to just reduce this to depression. But what I want you guys to know, because if we just reduce this likelihood of suicide to depression, we won't see and be aware of other things that could be contributing to things that make a person start having these suicidal thoughts and ideations and behaviors. Again, it was my own experience that led me to recognize in my client a couple of years ago what could possibly be going on with her. And when she did return, she returned like 2 weeks later, and I saw the person I had been seeing prior to her being prescribed that medication. It was just like a film had been taken off of her. It was herself and her energy again. So I encourage you guys to please educate yourself. There's so many layers, there's so many facets to suicide, so much education and awareness that is still needed. Next week, I'll be doing a podcast with a young lady who so graciously, so transparently and bravely shared her story on Facebook yesterday after the news broke with the meteorologist's death and passing. And she has agreed to come on my podcast and share her journey, because it's something that we all could benefit for, if not just for ourselves, for our loved ones, for our family, for our friends, for our coworkers, for anyone who could be facing just a mindset, or have it embedded in their mindset or their psyche that something's not right, and just don't see any other way out but to take their lives. But I want you guys, again, if nothing else to take away from this, is to understand that there's so many different layers to this, and it's not always just depression, and we have to be aware of that. Even Kimberly Craig, and I'm sure she wouldn't mind me sharing this because she shared it with public on one of her Facebook status several months ago, and I shared my story with her following that, because she bravely shared how some of the physical medications that she was taking for her health challenges she's been having recently actually led her to have some suicidal ideations, which she knew wasn't herself either. So this is very common. It's more common than people are willing to talk about, but it's time that we talk about it. It's time we have a conversation on all the different layers and all the different facets on this most unfortunate situation here that far too many of us, including myself and my family, have experienced. So I encourage you guys, just be on the lookout for this podcast I'm going to do. Educate yourself. And again, don't just reduce it down to the most simplest just explanation of depression. Although we know depression is real and depression is a major contributor to suicide, it's not the only contributor, and we need to educate ourselves to protect ourselves and to protect our loved ones. So hopefully this just shed some light on that, and just again be on the lookout for my podcast, and I'll talk to you guys soon. Take care.